Right, everybody. Welcome to another wonderful episode of MedNation, where medicine meets real talk. My name's Dr. David Farnen. I'm a board-certified podiatrist and foot and ankle surgeon based in Nashville, Tennessee. This podcast is all about diving deep into the world of healthcare, innovation, and the stories that shape medicine today. Whether you're a fellow clinician, a healthcare enthusiast, or just curious about what really goes on behind the scenes of medicine, you're in the right place. Let's break down the science, bust some myths, and have real conversations with the experts shaping the future of healthcare. Now, let's get started. This is Dr. Irit Van-Ham. And basically, we're going to talk all things toenail fungus today. Please go ahead and introduce yourself and tell us a little bit about you.
Sure. Thanks for having me. My name is Dr. Irit Van-Ham. I'm the Chief Technology Officer and co-founder of ToeFX. Just a little bit about what I did in the last 30 years or so. I have a PhD in physiology and pharmacology. I worked in pharmaceutical companies. I also am a toxicologist, so I worked in Canada in the Ministry of Health and Long-Term Care as a toxicologist. And many years ago, we founded ToeFX, so here I am today.
So interesting. We're going to get into the science of everything and so on and so forth. So let's talk a little bit about toenail fungus. Toenail fungus isn't just stubborn because it's aggressive, in my professional opinion. It's stubborn because it's protected. Protected by keratin, protected by slow growth, and protected by biology. And you figured out a way, and before we get into what makes this so interesting in ToeFX as a procedure and all, you not only just accepted the reality, but you created and helped create with your team, engineered around it. So when we say toenail fungus is stubborn, what's actually happening biologically?
As you said very nicely, fungus is a very resilient creature, but when it resides in the nail bed, so it's the surface underneath the nail plate, it's, as you said very nicely, very protected. And it's protected by the keratin, which is a super strong and dense protein. So keratin is, for example, the proteins that creates hair and horns and nails. So one of the most common fungus is dermatophytes. So it's microorganisms that feeds off keratin. So it has all the nutrition that needed. It also likes humid and warm environment. So it's perfect environment for the fungus to hide and reproduce. And it's very protected there. It's very hard to reach the nail bed where the fungus resides because the penetration throughout the nail plate is very, very difficult.
Yeah. Yeah, and that's what I tend to tell patients is, this is a marathon, not a sprint. When we initiate treatment, it's extremely well protected. It's extremely difficult to penetrate. So a lot of these over-the-counter products and medicines that people swear by and all these alternative therapies, which you've probably heard with Vicks Vapor Rub, yellow Listerines, I think those are hilarious because indeed, it's well protected within the nail bed. And so what role do you think biofilms play in recurrence? Another question, this is going to be a two-parter. How do dermatophytes, which are the most common species that we talk about, protect themselves once they colonize the nail unit?
Yes, good question. So not only that it's super difficult to penetrate the keratin, so the fungus are able to create a biofilm. So it looks often like patches. What it means that they create, so fungus it's like a community. So they send signals to each other. So for example, if they sense something coming, so they know how to actually go to the proximal, to the lower level of the nail and protect themselves. And also they create another level of protein, which is super, super difficult to penetrate. So for example, if you apply topicals, the chances that it will break the layer of protein, so it's like a fence that protects the community of the dermatophytes, is very, very challenging. So smart creatures.
Something they really are, and people don't give what I tell people don't give nails and the species in the nails enough credit, actually, because and something I typically tell my patients is you're not just treating the nail, you're treating what's living under it. right? And I think that's equally as important. So let's shift gears to over-the-counter products. People typically, before they reach me, unfortunately, they've been treating their nails for months and or maybe even a year plus with other topical nail products. What are the biological limitations of oral antifungals, as well as why do patients use topicals for months to see minimal results?
The biological limitation is penetration. So often, in order to kill or destroy a fungus, mold, yeast, whatever cause a toenail infection, it's a molecule. Normally, it's large that binds or sits or destroy and kills the microbe. In our case, as we said, the fungus is very protected, and those
Mhm.
molecules cannot, it's super difficult to penetrate the nail. So if it's superficial fungus, yes, it might help. If it's not, especially those cases that are severe and
Mhm.
all the nail is infected by fungus, it's super, super challenging for those topical drugs to penetrate.
Yeah, and very much, I completely agree with that. And so, let's shift gears to advanced modalities before we get into toe. We all hear that lasers sometimes help, and where do lasers help, and where do they fall short?
Laser can kill the fungus because they create high temperature. They can also, I heard a few days ago, it was new to me, but lasers can be used for enhanced blood flow because sometimes if there is a problem with the blood flow with older patients, so it might help, and then
Mhm.
it will initiate, a faster nail growth and
Nice.
overall speed up the healing process of the fungal infection. There's the limitations of lasers that they create heat, and
Mhm.
it's pain, like it can be very painful.
Yeah,
There is burning sensation, so
yeah.
it's about 50 something Celsius, and the body temperature is lower than 37, so it's very, very painful for the patient. Yeah, so it's hard to
Yeah,
tolerate.
you're absolutely correct, and I've seen this in clinical practice where, initially when I did laser, I had some, kind of elder patients and all patients alike, but elder patients in particular that did experience pain and some burning pain after the laser treatments that I performed. And sometimes some of my older patients don't like that. You know what I mean? So my younger patients can tolerate, some of my older patients are like, my nails are burning even hours after the procedure, not great. So
Yes.
now we get into the good juicy stuff being ToeFX. Let's talk about kind of the process that led you up to that. So what specific gap were you trying to solve when developing ToeFX?
So we like challenges.
Mhm.
We wanted to solve all the gaps that we talked about.
That's right.
We were aiming to, and we succeeded to solve the biological, physical,
Mhm.
and chemical challenges of penetration and killing the fungus.
Mhm.
So maybe I will compare it to lasers. So lasers, as we said, they work well in the lab. In practice, there is burning sensation. Also, most lasers are pinpoint.
Mhm.
And if there is a total involvement of the nail, it's super difficult, and I'm sure that you know, to eradicate or to kill all the areas, especially the biofilm, because
Mhm.
you're missing parts.
Right.
So we took something that's called photodynamic therapy. We borrowed the science from Mother Nature. So
Mhm.
photodynamic therapy exists. Also, the sun creates photodynamic therapy. There is dentistry to kill bacteria in the root canal uses photodynamic therapy. It's
Mhm.
uses for acne treatment to kill the
Mhm.
bacteria that causes acne. So basically, we took a light that penetrates very deep.
Mhm.
We combine it with a serum that penetrates. The serum marks down the infection,
Mhm.
and also it knows how to withdraw the energy of the light only to the fungus. So it doesn't do anything to normal cells, so there is no burning sensation, and it's very tailored to eradicate or killing only the invasive species.
Yeah, and I've had great feedback so far, just FYI, on the patients that Dr. Lanier, myself, my partner, and myself have done in clinic. We've had great feedback with, like you said, 0 to no pain, no issues post-procedure, so on and so forth. My question to you now, how long, based on evidence, how long does it take before patients see meaningful change?
So it takes about minimum 3 months to see a
Yeah.
change, mainly because the nail grows so slowly. So it grows about half a millimeter a month in good cases, sometimes slower. So it takes about 3 months to see progress. The reason is that the nail that's already infected by fungus, it's already destroyed. It has accumulation of keratin, it has
Mhm.
yellow patches. It's not going to get better. We are
Right.
looking at the proximal nail that coming, then the new nail that coming in from the proximal edge. So to see some progress, it takes about 3 months, but the treatment needs to be about 6 months. So we
Yeah.
base our protocol on lab data. So we did tons of few years of research in the lab,
Mhm.
and then we did clinical studies on severe cases. So people that had fungus for over 5 years,
Mhm.
few nails were involved, and total dystrophic. So all the nail is involved as well.
Yeah.
So
And then my question to you too, and this is something that I get often, probably one of the most common questions I get is what defines success in treatment? So no matter what treatment we do, in your professional opinion, based on clinical data and evidence, do we divide success by a clear nail, negative culture, or sustained remission?
it's a good question. I think it depends. So let's divide it to science
Uh-huh.
and then practical. So practically, I think it's yes, it's an infection, it's highly contagious, but it's people are super embarrassed.
Yeah.
So I would define success by clearance of the nail, uh,
100%. Yeah.
which allow, and you may disagree with me, but this, I think it's the most important to the patient. And then there is, yeah, it's called mycological cure, where you don't see fungus. And also with ToeFX, you can use it for, continue to use it to avoid reinfection,
Okay.
because there's few people that are more susceptible to get it back, similar to people that are more susceptible to get strep throat infection again and again and again. So it's also important to do some prevention. Use ToeFX once every 6 to 8 weeks. Disinfect the shoes. Be aware of the environment. Maybe look at the root cause of the infection and try to avoid reinfected. So, the fungus can reside in the shoes for such a long time.
Oh yeah, absolutely.
Uh,
That's something I tell patients and educate patients almost on a daily basis. When one of the first things I say is, we have to treat the root cause, right? So the nail fungus has already penetrated the nail; it's been there. That patient has probably seen it for months and or treat it with various ailments. But yes, I mean, we can get it fixed. But I tell people it doesn't matter how. I mean, it's of course a long process, but no matter how we get it fixed, like you said, I mean, you got to treat the root cause, and it lives in, these human environments, like you said, particularly shoe gear that people don't treat. And so that's something I treat frequently, or that's kind of almost a guarantee when you come in to see me that I am going to treat that. My question for you too, with ToeFX, what recurrence rates are you seeing compared to traditional options?
so traditional offers, normally when you read the literature, is about 50% recurrence rates. With
Mhm.
ToeFX, it's 15%. So it reduces significantly.
That's good. No, that's fantastic. And that's good for other, healthcare practitioners to hear that as well. So who do you think is the ideal ToeFX patient?
Um, I think the ideal patient is someone that has a severe case where all other treatments failed. And also the patient need to be compliant. So to come to the clinic every 2 weeks and to
Correct.
do his homework at home. And yeah, and then they should expect to see really good results.
Yeah.
What do you think?
I completely agree with you in all regards and everything you're saying in terms of people. And going back to the previous question, when you were like, you probably disagree in terms of mycological cure versus basic versus actual physical appearance. I think you're absolutely right. The patient would come in and be like, how much more of this do I have to do, whether it be a ToeFX therapy or a treatment therapy with a topical? And I see it completely cleared. That's when I know it's better. And I'm like, well, physiologically and from a medical standpoint, when we don't see any more fungus, right, in the actual
Right.
particular nail, but they care about the actual appearance, right? You're absolutely right.
Yes.
It's embarrassing, right? And, come a month here in Nashville, month or two rather, it's going to be sandal season. And so a lot of these people have worn socks their entire lives because of the embarrassment of nail fungus. So,
Yes.
you hit that right on the head. And then in terms of the ideal ToeFX patient, I agree. Someone who, is willing to be compliant. Cause I mean, that's something I do too. It's something I heavily weigh on and harp on in the clinic is it's a continual, treatment. This isn't one of those one and done things where, yes, you do ToeFX therapy, you're happy with it, no pain, you're starting to see improvement in 3 months, and then you're like, "Oh, this is great. It's just gonna grow out," right?
Yes.
And I think that's the assumption for the normal person. I'm like, "No, no, no. You gotta come in for frequent debridements," which I'll ask you a question here in a second. Another important thing I think, and I know I'm gonna ask you this, and you could probably see this coming is, do you think standalone or combination therapy is best? So, I have a lot of people asking that, right? So, if they do a laser therapy or they do a ToeFX therapy, do they think they need to continually do the topical as well?
So when we did our clinical study, we got really good results by looking at ToeFX solo.
Mhm.
So in order to see results, you don't need other treatments. However, it's super important, to my opinion, to combine it with everything that's possible. So
Yeah.
topical. Of course, let's talk about diagnostics after. Suitable topicals to treat the shoes, to maybe get a biotin
Mhm.
or and zinc supplement to increase the growth of the nail. If there is some trauma to the nail, so maybe fix that.
Mhm.
So again, that to avoid relapse. So I think these problems should be tackled from to use all the weapons that are available to you.
Yeah, 100%. And that's something I mentioned too, because people are like, well, if I invest my time and compliance and financially into this therapy, why should I do the other stuff? And I say, this is multifactorial. You got to treat it from all ends. I mean, not only just treating your shoes, but ToeFX is actually eradicating the fungus, but then adding a topical is just kind of a fail safe, right? But it also will make it, and I feel like if people stay compliant with that, I mean, they're going to see complete success.
Yes.
And so with that said too, how do you feel about diabetic patients or high-risk individuals with ToeFX therapy?
Yeah, it's really so it's non-invasive, safe, and non-toxic treatment. So it doesn't create heat or
Mhm.
thermal effect like lasers. So there is no risk for diabetic patients.
Yeah.
So it's
So yeah, and so let's touch on, I know we touched quite a bit on compliance, right? So how much of fungal treatment failure is really a compliance problem, do you think?
I don't know, but so
Yeah.
I'm a scientist, right? I
Right.
stick to the
Yeah.
fact.
Correct. Well,
Um,
yeah, I agree. Yeah, 100%. Yeah.
what I do know that sometimes the failure of treatment might be with the diagnostics. So
Mhm.
if the tests, if there is no, if it's a visual diagnostics or some other type of diagnostics that
Mhm.
it's not accurate enough, so
You're
that
right.
might contribute to the failure of the treatment because you're not using the right modality.
Yeah. And in my professional opinion too, I think simplifying treatment actually improves biological outcomes, right? Sometimes I tell my patients, let's just go, let's keep it simple, right? Like we don't have to do this super complex, hey, I need you to apply this topical only after you lightly file and debride and you
Yes,
shower for 12 minutes. Like keep it simple. People aren't gonna I think people shy away and get scared of that. I think we keep it simple. You do your ToeFX therapy. You come in when we ask you to do it because that is protocol. You treat the topical at nighttime, so on and so forth. You come in for frequent debridements and you see improvement, right? You see clinical outcome from that. So,
absolutely.
a couple things, I think the future of fungal treatment's exciting, right? And so I think where's fungal therapy heading in the next decade, do you think?
Um, I think it's should be sophisticated as ToeFX with few add-on and proper diagnostics. The diagnostics is good, but it's lacking somehow. We, for example, developed a really good PCR, so the diagnostics is very good. I think what's missing still is disinfectant tools
Mhm.
for the socks, for the shoes. There are solutions, but they are not good enough, to my opinion. So we are
Right.
working on something very cool. It will look
Yeah.
like an oven.
Hmm.
So it's coming
Interesting.
up in the next, I don't know, a year, 6 months to
Yeah.
a year. Uh,
Yeah. No, that's exciting stuff. And what innovation excites you most beyond ToeFX?
as a scientist, I love to solve problems, especially in healthcare. Um, So I think ever since I was a child, I knew that I wanted to contribute something significant. So I'm super happy that I can be offer something
Yeah.
that hopefully will stay on for a long time.
Mhm.
But what excites me the most um, is and I think everybody is talking about that. It's the AI.
Mhm.
I'm not super scared of that. I think we
Mhm.
can use it
Mhm.
to elevate what the human, being achieved so far,
Mhm.
and to use it. If we use it right, I think it's a wonderful tool.
Absolutely. I said you can harness that energy. I love the idea of advanced artificial intelligence, but I mean within reason. I have patients use it and say, I figure out all my medical problems through that. I'm like, please
Yes,
don't. Like, I just
no,
explained this to a patient yesterday. I was like, please don't do that. Like, that's why researchers and physicians and surgeons are can be replaced. Please do not look up your diagnosis and go deep into the clinical evidence of onychomycosis and therapies.
use it as an assistant, right? So
Right.
it's bring me information,
Right.
help me with the decision
Right.
process, and maybe help me to make faster decisions and more
Yes.
accurate.
Yes, yes. It's not perfect. It still hallucinates. It still
You
brings
hallucinate
negative
like
false
crazy. Oh my
information.
God.
Right. So, and I mean, I've used it in the past, and I'm like, with stuff that I am expert with, and I'm like, what is it telling me? So I can only imagine if patients put in a simple question
I
and it's
know.
telling you, hey, do this, do that, do that. And I'm just like, oh my God, I cannot believe. And I mean, of course, everyone thinks ChatGPT is their best friend. So they take that, the main source of information. So I'm like, it's exciting stuff. It will aid and help a lot. But like you said, within reason. One of the last questions I have for you is, if a patient has failed multiple treatments before, how hopeful should they be today?
Very hopeful.
Mhm.
Yes,
Absolutely.
there is a
And
good
and with
future for them.
ToeFX, with everything you've shared with us today, and with ToeFX that I've used in clinical therapy, and my partner, Dr. Lanier, is using clinical therapy, we're very excited about ToeFX and what it brings to the treatment of toenail fungus. And toenail fungus may be stubborn, but biology isn't unbeatable. And I think we have to just understand it to treat it. And I
Exactly.
think if we can end this today, tell me one interesting joke that you like when it
I
puts
like
you on the
to
spot.
I like very much to have to do exciting things in advanced, such as cycling, scuba diving, climbing, and yeah, lots of I have a long list of places that I want
Yeah.
to visit before I'm 80. So yeah,
You
the
got a long
world
way to
is so
go. So you
interesting.
Right, and that's incredible. Life outside of ToeFX is equally as important, and it kind of fuels your passion for the science and medicine and
Right.
you're reading it. That's a wrap for this episode of MedNation. If you enjoyed the conversation, make sure to subscribe so you never miss out on the latest in medicine and healthcare. Leave a review, share with a friend, and let's keep the discussion going. Follow us on social media at cefootandAnkle.com, as well as if you guys at ToeFX have social media as well, it'll be linked below for more insights, and stay tuned for more expert interviews and deep dives in the world of medicine. Until next time, stay curious, stay informed, and keep pushing the boundaries of healthcare. We'd like to thank you, Dr. Irit, for all the great information being a part of MedNation. And please, we'd love to have you back and maybe even have some patients on, or one patient on in particular that we've seen this effect on, kind of give you their feedback and have honest feedback with some of our patients. So we appreciate you, and I hope you have a great day, and thank you for being a part of it.